Established in 1924 by President Coolidge, the North Chicago VA Medical Center was originally named U.S. Veterans Hospital No. 105. It began operation in 1926 on 600 acres with 5 buildings and a 325 patient bed capacity. In 1979, the facility became the North Chicago VA Medical Center, and in 1989, it was officially incorporated into Veterans Integrated Service Network 12, or VISN 12. The Naval Hospital Great Lakes was commissioned by Congress in 1911 to support the newly established Naval Training Center at Great Lakes, Illinois. In 1956, Congress authorized the construction of Building 200H, which began service in 1957 and was officially dedicated in December 1960.
The Captain James A. Lovell Federal Health Care Center honors the legacy of the North Chicago VA Medical Center and the Naval Hospital and now Naval Health Clinic Great Lakes. It is the next transformation of these two organizations into something that's not been done before, and that is an integrated federal health care center. So while we honor the past, we need to be forward-looking, and by bringing together both the VA and the Navy, we think that that's what we're doing.
What we're looking to do, and this is important, is we're not talking about creating sort of a purple organization, which is just kind of a mishmash of both. We're talking about collaborative relationship between two traditional, very mission-focused and devoted organizations to take advantage of the strengths of both.
Because the Federal Health Care Center is an innovative and unique venture, combining the two cultures into an efficient, patient-centered operation is an exciting opportunity, one that requires flexibility, patience, and cooperation on the part of the Health Care Center staff. At the Department of Veterans Affairs, the Lovell Federal Health Care Center is part of the Veterans Health Administration, or VHA, which manages one of the largest healthcare systems in the United States. VHA includes VA medical centers, community-based outpatient clinics, and the Veterans Integrated Service Networks, or VISNs, that manage their activities.
In the words of Abraham Lincoln, the mission of the VA is to care for him who shall have borne the battle and his widow and his orphan. Today, that translates to providing the best care anywhere through an integrated healthcare system, meeting the healthcare needs of veterans from primary care to specialty care to long-term care and everything in between.
At the Department of Defense, the Navy Bureau of Medicine and Surgery, or BUMED, is the headquarters command for Navy medicine.
Navy medicine's mission under the direction of the Navy Surgeon General is to support the operational readiness and the operational care of the Navy and Marine Corps, in addition to our sister services, the Army and the Air Force, as necessary. BUMED is Navy medicine under the direction of the Navy Surgeon General. It is the support of those Navy and Marine Corps warriors, and that is the primary mission for Navy medicine, in addition to the beneficiary care that's provided and the humanitarian assistance, which has really been rolled into one of our critical missions.
BUMED has 4 support commands, including Navy Medicine East, which is partnering with VHA's VISN 12 in support of the new Federal Health Care Center in North Chicago. From a practical standpoint, the Federal Health Care Center partnership took shape in 2003, during Phase 1 of the project, when the Navy shifted its inpatient mental health services to the North Chicago VA-MC. Phase 2 of the project began in 2003, with a $13 million renovation designed to expand and upgrade the emergency room and surgical facilities at the VA Medical Center. This phase was completed in 2006, when the Naval Hospital Great Lakes moved its operating room, surgical, intensive care, inpatient medical and emergency room services for DoD beneficiaries to the North Chicago VA Medical Center. NHGL also moved its pediatric services for DoD beneficiaries, a first for a VA medical center.
The Navy had an older, open bay mental health ward. The VA had recently remodeled our mental health units, and we actually had beds available here at the VA, so it made sense to do that first.
Our phase 2 was then what we're in now, and this is what we would call a network relationship, where the North Chicago VA is like another network hospital for me as the commanding officer. But the difference is that my surgeons actually operate over there.
If you were to go into our OR today, you would see Navy surgeons working with VA anesthesiologists, VA nurses, Navy OR technicians, all working together for the benefit of both populations.
So this phase 2 has allowed us the opportunity to really explore those more in depth and to find out where those issues might lie. From that perspective, it is a test bed for where we're trying to go in phase 3 this October.
Whatever success that we've achieved so far with this partnership is a credit to the staff, both at the Navy and at the VA. Our clinical staff are very dedicated to excellence in patient care, and so with a lot of planning, with a lot of dedication, we've been able to stand up these different phases of our partnership in a way that keeps the patient at the center of what we do. Safety, quality, customer service, these are the hallmarks of a successful organization, and these are all evident here at North Chicago.
Phase 3, the final phase, culminates with the completion of a $71 million 4-story ambulatory care addition. This phase also includes the renovation of more than 45,000 square feet of existing space, the construction of a 553-car parking garage, and the creation of an additional 417 surface parking spaces. When completed, the Federal Health Care Center will officially become the nation's first fully integrated VA/DoD medical center, the Captain James A. Lovell Federal Health Care Center. Its mission: to provide comprehensive, compassionate, patient-centered care to our veterans and DoD beneficiaries while maintaining the highest level of operational readiness. Its vision: to create the future of federal health care through excellence in world-class patient care, customer service, education, and research.
The mission is both patient care and operational readiness. And so it's going to require providing the best possible patient care and ensuring that we are providing the services necessary in order to keep the naval staff ready to be deployed at any time.
In October 1st, 2010, we will stand up the Captain James A. Lovell Federal Health Care Center as a single system of health care. It's an opportunity to see if we can really craft a federal health care system of care.
We have an outstanding staff here at North Chicago and at Great Lakes. They have been very much a part of the partnership up to getting us ready for activation in 2010. They understand that this is not going to be the VA, this is not going to be the Navy, but rather this is going to be a new organization serving both populations and staying focused on quality patient care.
Welcome to the Captain James A. Lovell Federal Health Care Center.